Did you know that your foot can give clues about your liver health? Quite intriguing, isn't it? Today, we're going to delve into an unconventional yet insightful way of understanding our liver health, using our feet as the guiding tool. But let's get one thing straight before we dive in deep. What we're discussing here doesn't replace a professional medical diagnosis. The indicators we'll talk about might hint towards a potential liver issue, but they're not definitive. It's crucial to seek professional medical advice and undergo necessary tests to accurately diagnose liver disease. These clues are just tiny signposts that might help you understand your body better and prompt you to seek medical attention if needed. It's about being in tune with your body, understanding its signals, and taking appropriate action. So with that being said, let's dive in. First off, we're going to talk about little red and brown dots on your foot. Now, these dots can vary in size. Sometimes they're larger, sometimes smaller. They might even have a slight shininess to them. More often than not, you'll find these dots on your lower leg. Why does this matter, you may ask? Well, these dots could potentially indicate poor circulation, a common issue associated with liver problems. But it's crucial to remember that this isn't a diagnosis. It's a potential sign, a clue, if you will. Other health conditions like diabetes could also cause these dots to appear. The foot, particularly the lower leg, can give us a wealth of information about a person's overall health. The heart, an essential organ, has to pump blood all the way down to your feet and then back up through your vascular system. This journey is quite a feat, pun intended, and signs of poor circulation often show up in the areas furthest from the heart. This is why we often see these dots on the lower leg or foot. It's a challenging task for the heart to pump blood to these distant parts of our bodies, and when circulation isn't at its best, these red and brown dots can appear. Now, it's not just about the heart and blood circulation. For instance, in conditions like diabetes, you might observe neurological issues in your feet and hands. This is because these areas are the furthest from the heart, and hence they often reveal signs of health issues first. So, when you spot these red and brown discolorations or specks on your lower leg, they might be trying to tell you something about your health. It's like your body's way of raising a red flag, signaling that something may be amiss. In conclusion, the appearance of small red and brown dots on your foot could be a potential indicator of poor circulation, often associated with liver problems or diabetes. It's not a diagnosis, but it could give you a heads up about some health issues, so keep an eye out for these little discolorations on your feet. Next, let's discuss something called spider veins or spider nevus. These are tiny, visible blood vessels that branch and spread in a web-like pattern, often noticeable on the lower legs. They might remind you of a spider's web, hence the name. Spider veins are typically a sign of poor circulation. But did you know that they are often related to liver health? Indeed they are. In fact, spider veins are commonly seen in cases of liver cirrhosis. Cirrhosis is the late stage of chronic liver disease where healthy liver tissue is replaced with scar tissue, affecting the normal functioning of the liver. But what does this have to do with spider veins, you ask? Well, the answer lies in a hormone we all produce, estrogen. When the liver is in a healthy state, it effectively regulates and balances our hormones, including estrogen. However, when the liver is diseased, it may struggle to break down and eliminate excess estrogen from the body. This buildup of estrogen can affect the vascular system, leading to the formation of spider veins. Interesting, isn't it? How something as seemingly unrelated as spider veins can give us clues about what's going on in our liver. But remember, the presence of spider veins alone doesn't necessarily indicate a liver problem. They can also be caused by other factors such as age, heredity, pregnancy, and prolonged periods of standing or sitting. However, if you're noticing an increase in spider veins alongside other symptoms we've discussed, it might be a good idea to check your liver health. In other words, if you're seeing spider veins popping up, it's not a reason to panic, but it's definitely a reason to pay attention. It's like your body's way of waving a little red flag saying, hey, something might be off here. So, if you're noticing spider veins, it might be a good idea to check your liver health. After all, it's always better to catch potential health issues early when they're easier to address. And the first step in doing so is listening to what your body is trying to tell you. Now, have you ever wondered why your heels crack? We often chalk it up to dry skin or neglecting our foot care routine, but it's time we delve deeper. Cracked heels could potentially indicate a deficiency in certain nutrients, more specifically vitamin B3 and omega-3 fatty acids. Interesting, isn't it? Let's break it down. Vitamin B3, also known as niacin, plays a vital role in our body. It helps convert food into energy, repairs DNA, and acts as an antioxidant. But why does a deficiency show up on our heels? Well, vitamin B3 is crucial for skin health as it helps in the formation of keratin, a protein that strengthens the skin. When there's a shortage, your skin may not be as resilient and cracks could form, especially in areas of high pressure like our heels. Moving on to omega-3 fatty acids. They're the good fats, the ones we're always told to consume more of. They're essential for brain function, heart health, and you guessed it, skin health. Omega-3 fatty acids help to maintain the health of the skin's outer layer, which acts as a barrier to keep moisture in and harmful bacteria out. A deficiency could lead to dry skin and yes, those pesky cracked heels. But what does all this have to do with the liver? Well, the liver is a vital organ that plays a key role in nutrient metabolism and absorption. It helps to produce bile, which is necessary for fat absorption. So if your liver function is compromised, it could potentially lead to a deficiency in vitamin B3 and omega-3 fatty acids, regardless of how much you're consuming in your diet. So the next time you notice your heels cracking, don't just reach for the foot cream. It might be worth considering if your liver is trying to tell you something. Remember, our bodies are complex and interconnected. A sign on the surface, like cracked heels, could be a window into something happening deeper within. So, those cracked heels may be more than just a cosmetic issue. Moving on, did you know that an itchy foot can be a sign of liver trouble? Yes, you heard it right. An itch, especially at the bottom of your foot, might be more than just a pesky annoyance. It could potentially signal a congested liver. Now, what's a congested liver? It's a liver that's not functioning as efficiently as it should be. The problem could be due to a buildup of bile, a yellowish fluid that aids digestion. You see, one of the liver's many jobs is to produce and release bile. But in some cases, this bile doesn't flow as freely as it should. Instead, it backs up into the liver, causing congestion. But what does this have to do with your itchy foot? Well, when the liver is congested, it can result in a buildup of histamines. Histamines are chemicals your body produces when it's injured or in response to an allergic reaction. When they build up, they can cause itching. And this itch tends to show up in areas like the bottom of your foot. However, it's important to remember that an itchy foot alone isn't a definitive sign of a congested liver. It's just one potential clue. Other symptoms could accompany it, like jaundice or a general sense of being unwell. And remember, a congested liver isn't something to diagnose at home. If you're experiencing persistent itching, especially along with other symptoms, it's always best to consult a healthcare professional. Also, keep in mind that a congested liver could be a sign of other health issues. For example, if you're dealing with a congested liver, chances are you might also be experiencing problems with your kidneys or colon. These organs are all part of your body's detoxification system, so if one isn't working right, it's likely others aren't either. So the next time you feel an itch at the bottom of your foot, don't dismiss it. It might be your body's way of signaling that your liver is having a hard time keeping up. Remember, your body is a complex machine, and every little sign could be a clue to your overall health. So that annoying itch might be your body telling you something important. Lastly, let's discuss a condition known as pitting edema. This is a peculiar situation where you press your finger into the lower leg and it leaves a dent that just stays there. It's as if your skin has suddenly decided to play a game of memory foam with you. Now, why does this happen? Well, it usually indicates a buildup of fluid in your body, often due to poor circulation or issues with your liver or kidneys. Now, how does pitting edema connect to liver health? Well, your liver plays a significant role in maintaining your body's fluid balance. It produces albumin, a protein that helps keep fluid in your bloodstream so it doesn't leak into other tissues. If your liver's health is compromised, it may not produce enough albumin, leading to fluid leakage and hence pitting edema. But it's not just your liver that's the potential culprit here. Pitting edema could also be a side effect of certain medications. Some drugs can cause water retention in your body, leading to this unusual swelling in your lower legs. Then there's the issue of diet. A high-sugar diet, especially one rich in high-fructose corn syrup, can also lead to pitting edema. Too much sugar can damage your liver over time, impairing its ability to regulate fluid balance. Next on the list is alcohol. Excessive alcohol consumption is a well-known enemy of the liver. It can cause inflammation and damage to liver cells, hindering its vital functions, one of which, as we've just discussed, is fluid regulation. Lastly, let's not forget about protein. Consuming excessive amounts of protein can put a strain on your liver, potentially leading to fluid imbalance and, you guessed it, pitting edema. So if you're noticing some unusual swelling in your feet, it might be time to take a closer look at your diet and lifestyle. Remember, these signs are not definitive diagnoses, but they can provide valuable clues about your overall health. Always consult a healthcare professional if you have concerns. It's always better to be safe than sorry. So, as you can see, our feet can tell us a lot about our liver health. They hold clues that can help us understand what's going on inside our bodies. From the red and brown dots that signal poor circulation and can be an indicator of liver issues, to the spider veins, which are often seen in cases of cirrhosis and can be due to an excess of estrogen disrupting our vascular system. We also touched on the topic of cracked heels, which are usually symptomatic of a deficiency in vitamin B3 or omega-3 fatty acids. The liver's role in making bile and helping us absorb these fatty acids is crucial, and problems with these processes can manifest in skin issues like these. Itching of the foot, particularly at the bottom, can also be a sign of a congested liver, with bile backing up and causing a buildup of histamines. And let's not forget pitting edema, the condition where pressing your finger into the lower leg leaves a lasting dent. This can be a side effect of certain medications and excessive intake of sugar, especially in the form of high fructose corn syrup or even excessive alcohol and protein consumption. All these are just potential signals that your body might be sending you, indicating that something is amiss. They are not definitive diagnoses, but they are signs that you should not ignore. If you notice any of these symptoms, it's important to seek medical advice. Your health is not something to gamble with, and being aware of these signals can potentially help you catch a problem early before it escalates. So let's keep an eye on our feet and an even closer eye on our overall health. Remember, your health is in your hands. Thanks for watching, and don't forget to like and subscribe for more health insights.